ask him to come. Yeah. No, ask him to use our common printer. No, common copier or printer. I cannot go down. I'm feeling the control. I'm feeling to start the control. So do one thing. Ask him to go to third floor in my office. In my office, the debrief room. Debrief room. There is no number. Debrief room. Second room. Yeah. There is one printer. Ask him to remove the USB and connect it. Okay. Or the USB also you can use. Okay. certain.
In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Task Force for Combating Coronavirus COVID-19, His Excellency Dr. Walid Al-Mana, Under Secretary of the Ministry of Health, and Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages, and we also have the journalists and reporters remotely. Now, as usual, we begin with Dr. Walid Al-Mana, Under Secretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings and grace, and praise be to the Prophet. I'd like to welcome you today, where we meet to inform you on the most recent updates regarding dealing with COVID-19. Well, following the review and approval of the Executive Committee headed by the Royal Highness, the Crown Prince and the Prime Minister, and based on the latest developments and data related to COVID-19, and also the success of the national vaccination campaign, with the percentage of those receiving the first and second doses reaching 94% of the total eligible, and also for those receiving the booster dose of 83%, which was reflected in the decrease in the number of the active cases in hospitals and intensive care. And as confirmed by the national studies and indicators regarding the new variant Omicron, as it was found that its complications are less than the previous variants, especially for those who received the booster dose and who are vaccinated. And also the proven effectiveness of COVID-19 rapid test. It was decided that starting from Sunday, 9th of January 2022, the test procedures will be updated according to the current phase in dealing with the COVID-19 as follows. First, to intensify the PCR tests for those who have any symptoms like the fever, coughing, or difficulty in breathing, and for those who have the result as positive, and also for the contacts of the active cases. Second, to intensify the rapid test for all those working in the active sectors. 3, to update the procedures for passengers, whether vaccinated or non-vaccinated. First, to show a PCR certificate through 72 hours of the arrival and leaving of the Kingdom of Bahrain. Also, to conduct a PCR test upon the arrival only, and to reduce the cost of the test to 12 Bahraini dinars only, and to continue having the quarantine for 10 days in the housing or residency. Fourth, to continue having the campaign for vaccination within the same pace. Also, to maintain the capacity of the hospitals, and also to have the sense of responsibility by reporting any symptoms like fever or coughing or difficulty in breathing, and also to encourage those to take the vaccines and the booster dose in order to protect the society and families. So it's important in dealing with this current situation to be aware, and within the discovery of the new variant, it's normal to have these procedures and to take the treatment in hospital, or if they require intensive care. And thank God, in the Kingdom of Bahrain, the rates are really low locally due to the success of the procedures taken to protect the citizens and residents alike through the vaccination campaign and other procedures to combat it. And I stress the need to take the COVID-19 test whenever they were experiencing any symptoms. So over the coming days, if you experience any symptoms like the fever, difficulty in breathing, or coughing, you just need to focus on these categories. And of course, this is for the safety of everyone. And to conclude, I remind everyone, the societal awareness is important for everyone in order to maintain the health and safety of everyone. Now I'll leave the floor to my brother, Lieutenant Colonel Dr. Manaf Al-Qahtani. Thank you very much, Dr. Walid Al-Mana. In the name of God, most gracious, most merciful, good evening, everyone. First, I'd like to welcome you to this press conference, through which we are going to share some points and explain the mechanism of the precautionary measures at this stage. As mentioned by Dr. Walid, I also confirm that the efforts of the Kingdom of Bahrain over the past 2 years in combating COVID-19 in all the stages have proven its effectiveness and success at all levels. And we took the initiatives to implement all the plans and precautionary measures which were proven to be successful. And me as citizen, before being a member of the National Task Force, I feel comfortable because the decisions taken are reflected on reality, and they are more into logic. And we have sensed this for the past couple of years, and we remind that shifting through according to the traffic light mechanism, and as explained before as the average of the intensive care. So right now we're focusing on the active cases in intensive care ICU unit and not like according to the average of the active cases before. Also, with the appearance of the Omicron variant, we note that the increase in the number of the active cases is normal, and we have noted that this virus have less symptoms compared to the previous variants, and that's what we observed with even having those patients admitted in hospital. And thankfully, the health situation and conditions are mild, and thank God, the few active cases registered who required to be hospitalized or in the ICU shows the success of the procedures taken to protect the citizens and residents. And we confirm that every stage has its own standards, so we cannot implement all these standards in all the stages because the virus is changing and is different, as we call it in epidemiology, as dynamic. Then we have to cope with these changes, and this is one of the means in combating this COVID-19. And in the Kingdom of Bahrain, we put the health and safety of citizens and residents as an utmost priority in dealing with COVID-19. And this is what we noted from the beginning of COVID-19, and all the decisions taken were into the achieving this objective. So our kingdom is going into the right direction in dealing with this virus, including dealing with Omicron or any other future variants. And thank God the symptoms of this variant are less than the previous ones, especially for those who took the vaccine or the booster dose, and shows that the procedures in the Kingdom of Bahrain, that the vaccine is the only way to get out of this pandemic successfully. And I call upon everyone, those who did not take the vaccine or the booster dose, please do, in order to maintain their health and the public health, and also to be societal aware. So if you experience any symptoms like the flu symptoms, please take the test using the current tools. Any symptoms like fever, coughing, or difficulty in breathing. And to conclude, I confirm that it's important to strictly follow all the precautionary measures by the society, along with taking the vaccines and the booster dose according to the local protocols, because every stage has its own standards in order to maintain the health and safety of everyone. Thank you. Thank you very much, the speakers. Now we start taking the questions from the journalists and reporters who are joining us remotely. We start with question to Dr. Walid Al-Mani from Naila Barakat, Bahrain News Agencies. Is the fourth booster dose will create immunity as fifth double or fifth 5 times, and will the focus should be on those hospitalized and not active cases? Thank you for the question. Well, first, the booster dose, the fourth booster dose, will double the immunity 5 times. I don't think we have studies like double or 3 times or 5 times. regardless of the number of the booster dose, it will have a main function. And we know that the vaccine has time for it, and the period should be, according to its function. So to have a booster dose is to maintain a standard of immunity and to stay away from any complications or to be hospitalized. So to have to be like, we don't have statistics or fixed study or scientific study, but as I said, the main purpose of booster dose is to enhance immunity in order to protect us from the complications. The second one is about if there is any trend to assess the situation according to those hospitalized. This is what we mentioned. The evaluation according to the traffic light system, whether green, yellow, or orange, the evaluation will be largely on those who need to be hospitalized or admitted into ICU. So we might have a large number of active cases, but due to the success of the strategic plan in Bahrain, we found that we had, less people hospitalized or need to go to the ICU. So according to the experts in the US, and we of course take the experience, the Bahraini experience, we found that according to this disease, we have, the large number of active cases does not mean that the situation is bad, but it's rather the number of those hospitalized and the ICU. So thank God we have less numbers now. The second question from Tamam Busafi, Al-Ayyam newspaper, to Dr. Manaf Al-Qahtani. We now have more than 6,000 active cases. Only 13 are hospitalized. So is it not now worrying that the active cases don't need treatment? Thank you very much for the question. I think this is the right question to ask. Many people now are asking what's the difference between active cases and those hospitalized. If you allow me, as I mentioned, the epidemic is going through different stages and conditions. So 2 years ago and up to now, every situation we have different stages. From the beginning, we had less information, so the preparation was less. We did not have the treatment, the vaccines, but at one stage, the procedures improved. We detected the number of active cases, and therefore the procedures changed. So it is not logical, like from 2 years up to now will be the same. Because as mentioned by Dr. Walid, if the country provided treatment and medicine and vaccine and sufficient beds, and the intensity of the disease will be less, by nature we'll have difference between, those hospitalized. And if they were hospitalized, we will see the level of those. Are they medium or severe? So for us as a medical task force at one stage to intensify the efforts on those who are severe in order to focus our efforts to provide the best care. Let me just give you a simple example. If I am managing an emergency in a hospital and it represents a country or society, and if they provided beds, the tools, the medicine, and everything we need, so the doctors in the emergency will only focus on the critical cases, and which might cause, pressure on the health system. So as we have reached a high percentage of vaccines and a high percentage of booster dose, and the health situation is comforting, so maybe the focus now is on those who are not vaccinated or who lack immunity in order to protect their health and souls. Thank you. Al-Watan newspaper, Muhammad Rashad to Dr. Manav. With the increased number of the active cases who are coming to Bahrain from outside, from abroad, shouldn't there be a need to have institutional quarantine? And is there any advice for citizens or residents not to travel only if necessary? Well, part of the question I answered. The strict procedures like the institutional quarantine, when we established that at the beginning, perhaps at the beginning we were dealing with a virus which was totally different than now. So we cannot implement or repeat the same procedures now. But the most important thing that the virus is not coming from outside Bahrain or from abroad. Whether I close the borders, the virus, there are many ways for the virus. And we shall not forget that there are some humanitarian or social needs for people to travel. So let's say if we have a pandemic, if the travel is not necessary, it is better to postpone it until the situation will go back normal, because we are part of a globe. And so unfortunately, some countries are still having an increase in the active cases and hospitalized cases. So if the travel is not necessary, it should be avoided. And if they had to, then they had to implement all the precautionary measures, even if the country of destination does not require it. They should do it and implement them. And the same thing when they come back from those countries. It is obvious that you should not contact those with weak immunity people or those who have chronic diseases. And if you experience any flu symptoms, you should take the test, and you shouldn't just say, well, it doesn't matter and I don't need to know. And you should take the test and isolate yourself. So if you have this self-awareness, I think even the strict procedures will be not necessary. So it is like a humanitarian social initiative that should come from ourselves to implement the procedures, and therefore we wouldn't need strict procedures. Pradeep from Daily Tribune to Dr. Walid Al-Mana. Are there any threats from the new variants? Take into consideration the increase in the number of the active cases. Thank you, Pradeep, for the question. First, I was attracted by the word threatens. Hopefully, there will not be any threats in Bahrain. Maybe now preparation, this could be the word. Well, thank God we have the preparations in Bahrain. If God forbids we needed it, we have the preparation for the ICUs, for the beds, for the critical cases, and also for the tests and for the vaccines. So thank God in Bahrain, we have a great plan to be prepared. And among the important points in Bahrain, in this press conference, is that we have the readiness. So yes, but there are chances for improvement. As for the new variant, thank God, we have not seen any threats or challenges, because thank God, the active cases are less who need to be hospitalized. Maybe the active cases, all of them are precautionary. For those in charge of treatment, they care about the patient and not to go into critical level. So even those hospitalized, it could be just precautionary. And for the new variant, so yes, we don't have challenges. And for any variant, for any updates, we're going to cope with them with our readiness. We are really taking all these risks into consideration, and we're assessing them on a daily basis and also on an hourly basis. And hopefully we're going to get rid of this virus. And as before, we have taken precautionary measures, and we're going to go into the same line. Also to Dr. Walid from Rasha Al-Ibrahimi, Bana, does this stage require us to have online learning? Thank you. If we're talking today about the precautionary procedures, we've seen that we have decreased them. So yes, the measures are there, but people might expect like strict, like distant learning, but their awareness is important. As for distant learning, we have set in this yellow level, this is optional to attend schools. The advice from the medical task force after the holiday that at least like 10 days to be online, and especially for those coming from travel who are coming from Bahrain. And as for the daily life or for the schools, I think for the level, we have not given any advice or like to be recommended to be. It will be assessed later, but now it is optional for students to attend schools, and hopefully there won't be any problems. Well, now we conclude the question and answer section. Thank you very much to the speakers for your briefs. Also, thank you very much, ladies and gentlemen, and also for the journalists and reporters. And before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19. Thank you very much.